As spring swings into high gear, it's time to focus on improving your self-care routine and overall well-being. Well, unfortunately, this may be easier said than done. April is IBS Awareness Month, and Dr. Jack Braha and patient Cecile Rooker are here to talk about living with and managing IBSD. Good morning to the both of you. How are you?
Good morning. Thanks.
Good morning.
So IBSD, what does it stand for? And it is not something that a lot of people want to talk about, but a lot of people battle it, right, doctor?
That's correct. 16 million Americans with IBSD, irritable bowel syndrome with diarrhea. It's a condition of abdominal pain associated with changes in bowel habits. Diarrhea, people have frequency, and the patients report that this can occur at any time, and they run to the bathroom sometimes unexpectedly. And it affects, as we said, 16 million folks. And I'm working here today with Allergan to help spread the word of some treatment options that could be available. And this really goes in conjunction with the patient's physician. And so that's the first important step, is to see your doctor, discuss symptoms, go over diet modifications. There are some over-the-counter remedies to decrease diarrhea for short-term use. And a proactive approach, which is available, called IBSD, taken twice a day, can help patients get ahead of their symptoms, decreasing diarrhea and abdominal pain. And they may have some side effects such as abdominal pain or nausea. And it's not for folks who don't have a gallbladder, but it is indicated for IBSD in order to help patients reduce their abdominal pain, urgency, and diarrhea. So it's important to have that conversation with your doctor.
Well, I want to bring in Cecile. And when did you know it was time to call your doctor about this and actually start talking with him and then eventually get the diagnosis?
So I was actually diagnosed with irritable bowel syndrome when I was younger, around college age, early 20s, and had been told by the physician at that time that there was absolutely nothing that could be done. So I just lived with it. I went through my life feeling that I just had to try to manage my symptoms the best I could on my own. Did this for many years, and then my daughter started showing symptoms of irritable bowel syndrome. And it was at that point that I knew that I had to revisit this with the physician, and both mine and hers, to discuss what options were now available and to understand more what irritable bowel syndrome is and how it can be managed and treated.
And how has your life improved since you started the treatment? I think we need to give people a glimmer of hope because, again, it's something that you don't want to deal with and people don't really want to talk about. So what's the improvements like now, Cecile?
So there are so many life-changing improvements that you can have when you have your disease under control. You go from wondering where every bathroom is, everywhere you go, to having a little less stress over that sort of thing. You'll always look for the signs, but it's not a matter of panic when you walk into a building. I also have not had to cancel any dinner dates or play dates for my children in many, many years, and have been able to live my life and plan vacations, trips, that sort of thing, without the worry and concern that I might have an episode.
And doctor, I want to get your thoughts in closing. What do you want people out there to know about IBS and maybe getting treatment? What people need to keep in mind, since again, it's not really talked about a lot?
Well, the first thing is, as Cecile mentioned, it's so common. This is a disorder that affects 16 million people. Don't be alone. See your physician. Open up that conversation with your doctor about the bowel movement abnormalities. Don't be embarrassed. That's what we're here for. We expect to hear this. And then you can decide on good treatment options, as we discussed before. And it is important not to forget that the doctor will help you if you open up about your symptoms. IBSD is a proactive approach. We can get off the merry-go-round of trying to change diets and use other supplements or treatments. And if they haven't worked, it's important to know that there are some newer treatments out there that you may be a candidate for.
Well, thank you to the both of you for coming in and talking about this. We do appreciate it, and most importantly, getting the information out to those who need it. Have a good one, and thanks again.